rather than APA view, you can have lateral view. Some center even do lateral view routinely, just to screen patient. So just remember that you have the options to investigate more, because the dilemma of being frontline, the GPs, the family physician, is sometimes you are not so sure in the chest X-ray PA view, the common one, but you feel hesitate to pursue, especially it looks very well. So these are the things that sometimes make the patient missed to be investigated more. So if you ask me as a radiologist, I would like to have a lower threshold to investigate more, because of course, out of 100 patients go for, like, they are healthy, they go for screening, but maybe one or two suddenly you see some strange diagnosis. But in order to get that one or two, the investigation must be widely available for everybody, or else we wouldn't catch all these small early cancer in the society. I give you some example in this chest X-ray. You can see here. So this chest X-ray, if you can see there is a focal, well-defined nodular opacity in the left lower zone. So this is chest X-ray of screening patient. Patient is healthy. They just come for screening to see the lung. Should you see this, what would you do? Are you confidently say that this is a nipple, or could it be an early lung nodule? Because in that chest X-ray, that is actually definitely significant, because if you can see that in chest X-ray, if it is a lesion, then it's a significant lesion. At least patient need a CT scan or even biopsy. So these are the example of the dilemma sitting in the probably screening center or in your clinic, where patient, it looks very well, but there's something in the lung. You want to ask for CT scan, but it's a bit too much because we think it's a nipple. So what can you do for the patient with such a finding? So this is where you come. You do a chest X-ray with nipple marker. So as simple as a repeat chest X-ray with nipple marker can already assure you that it is not intraparenchymal lesion. So do not neglect all these function of multiple views, because it can help you easily be certain on what you are seeing. If should be the shadow is outside the nipple marker, then you know this patient need something more than just chest X-ray. All right. Okay.